Natural or man-made disasters, utility failures, and fires can strike at any time. These events don't always give a warning, nor can their impact be predicted, so you must be ready now for what's next. We know that evacuating a healthcare facility is a high-risk procedure involving the movement of your patients, visitors, and staff away from an at-risk location. Without a standardized process in place for evacuation, unnecessary injuries, costly mistakes, and bottlenecks will occur. DQE gathered the best practices of emergency evacuation procedures and used its extensive experience in healthcare emergency management to develop the PACE Evacuation Toolbox. The PACE Evacuation Toolbox was created to address patient preparation, movement sequencing, resource utilization, and information sharing to simplify the way you perform an evacuation. The goal is for staff on each affected unit to prepare and track patients using proven methods so patients can be moved in a coordinated manner based on their mobility level. This process includes activating a hospital incident command evacuation group, assigning staff to patient assessment, horizontal movement, and holding area positions, and then preparing patients for evacuation. PACE stands for Patient Assessment and Command Essentials. The PACE Evacuation Toolbox is an organized system that will bring your evacuation plan to life by giving you tools to maximize efficiency and staff response during an evacuation event. Stored and ready to deploy in every patient care area, the PACE Evacuation Toolbox divides its patient evacuation tools into three main sections: incident management supplies that help prepare your staff for their responsibilities, patient preparation supplies for readying patients for movement, and support supplies, which make the whole evacuation process easier. All of this is stored in a durable plastic case for long-term storage. During an evacuation, a PACE Evacuation Toolbox will be located in each patient area to help leadership organize staff and prepare patients. Let's take a look at each toolbox section in greater detail, starting with the incident management section. This section is for the healthcare staff that will evacuate rooms and move patients. There are lightweight, reflective evacuation ID vests that have titles that follow the hospital incident command model. Along with the vests are job action sheets to assist staff in organizing their individual tasks. Also included are handy pocket reference guides to help staff remember key concepts on the fly. A staff that is organized and ready to move is the key to an efficient evacuation process. Next is the patient preparation section that prepares and organizes patients for movement. This section includes the Patient Evacuation Go Pouch, Patient Information and Tracking Form, Medication Transfer Bag, Mobility Level Wristbands, Go Pouch Clip, Patient Assessment Door Sign, and the Evacuation Door Sign. The main component of this section is the Patient Evacuation Go Pouch. This durable, gusseted Tyvek envelope stays with the patient through the evacuation process. The contents of this pouch secure patient information, medication, and supplies. Use the duplicate Patient Information and Tracking Form to record vital patient information, such as allergies, primary diagnosis, and level of consciousness, as well as patient transportation information. Place the completed form in the clear front window of the Patient Evacuation Go Pouch. Use the Medication Transfer Bag to transport medications in the Go Pouch. Identify a patient's mobility level for movement with the color-coded mobility level wristbands. Tyvek wristbands include the following mobility levels: walking, wheelchair, stretcher, discharged walking, discharged wheelchair, discharged stretcher, and observation needed. The entire Go Pouch is tethered to the patient with the Go Pouch clip so that critical items remain with the patient during transport. Use the removable Patient Assessment Door Sign to signify that the patient is prepared for movement. Now the patient is ready to be transported when directed. Use the removable Evacuation Door Sign to show that the patient's evacuation is complete. The last section of the Patient Evacuation Toolbox includes many support supplies. These items will provide additional assistance in organizing your evacuation. There are light sticks with hooks that attach to patient or staff clothing or simply light pathways and stairwells. Equipment tracking labels identify equipment so it's returned to the proper location. There are clipboards and writing utensils for completing patient forms and marking doors and windows with removable markings. A roll of caution tape for securing quarantined or dangerous areas is included, and what would any toolbox be without a roll of duct tape? DQE has thought through the details. Each item in the toolbox has been carefully selected for quality and practicality, so you have what you need when you need it. Evacuation is a critical process that healthcare facilities must master to be truly prepared caregivers. With a PACE evacuation toolbox in each patient care area, you'll have the supplies necessary to successfully perform your evacuation process. Bring your evacuation plan to life with the PACE Evacuation Toolbox. The PACE Evacuation Toolbox is available to order online at www.dqeready.com/evacuation or by contacting DQE at 800-355-4628.